Okay. Diabetes is a condition in which the body does not properly process food for energy. The pancreas is an organ that is near the stomach. It makes a hormone called insulin to help glucose get into the cell bodies. When you have diabetes, your body does one or the other, which means it doesn't make enough insulin, or it can't use its own as well as it should. This is what causes the sugar to build up in your blood. Diabetes can cause serious health issues like heart disease, blindness, kidney failure, and lower extremity complications. Diabetes is the 7th leading cause of death in the United States.
Diabetes disproportionately affects people of color, resulting in over 40% of diagnosed diabetes cases. 10% of the entire United States has diabetes, and studies have also shown that there are direct correlations between food insecurity and lack of healthcare access and incidence rates of diabetes type 2. People with diabetes are 3 times more likely to also have depression, and their rates of anxiety increase by 20%.
I knew a woman named Angela for about 3.5 years who was diagnosed with type 1 diabetes. She was actually born with it, but none of the effects really got to her until she was about 8 years old. She oftentimes got the stigma thrown onto her, but it was kind of on the inverse way. So she, whenever most people wouldn't expect her to have diabetes because of how she looked and how she acted. She was very hardworking. She would come into work all on time every single day, but sadly she could only work about 10 hours per week and only about 2 hours per day because of her condition. She was constantly on the waiting list to get new kidneys as well as a new pancreas because her kidneys were beginning to fail due to the diabetes, and of course she needed a new pancreas due to the diabetes. Sadly, she's no longer with us. She passed away in her mid-30s, but she was a very hardworking woman.
The term diabetes carries a lot of stigma. Negative stereotypes about the disease help to create this stigma. Due to a lack of knowledge about the disease, some people think that those with diabetes do it to themselves. If they would eat better, then they wouldn't be sick. Others think those with diabetes are lazy or that they just need to lose weight. However, those stereotypes are far from the truth. This forces those with diabetes to have to handle their medical needs as well as social stigma from society. The stigma is undeserved and negatively affects the individual in all aspects of life. Examples include social relationships and financial concerns due to some employers refusing to hire individuals with diabetes. This refusal to hire is a version of marginalization and can send the individual to the brink of society outside of the cultural circle and dependent on others. There are many people who suffer from the structural idea that those with diabetes aren't doing everything they can to be healthy. It affects all individuals differently, but the negative societal view remains the same. Disparities against those with diabetes are evident in healthcare and the workforce. People of color make up a large portion of those with diabetes, and that adds on to the disparities as life expectancy is less than whites, which indicates disparities against people of color in healthcare. Sometimes it might be hard to combat internal oppression. You can let the thoughts get to you or try to overcome them. One way is that you can try to overcome negative thoughts is when you have a conversation with yourself, you just tell yourself positive things. A few things you could do is tell yourself, I can do this, or I won't give up, or nobody is perfect. I learned something today, and I will be better equipped to handle this challenge the next time. It is vital to focus on the things that you can do to help make your diagnosis more tolerable. To change the disparities, we propose that job applicants should not have to list whether they have diabetes to combat hiring disparities. Educating about the public about the causes of diabetes and its effects should be a priority to lessen the negative thoughts and stigma towards those with diabetes. Each individual has a responsibility to do their part in fighting the structural inequalities against those with diabetes.